Let me ask you something. When's the last time that you finished a procedure and felt like you actually changed somebody's life? If you're like most general dentists that I know, you're tired. You're tired of re-cementing the same crowns and fixing the same teeth over and over again, and you're tired of the 8-hour chairside grind. Here's the part that they don't teach us in dental school, that the difficult dental patient that you keep seeing isn't actually that difficult. You're just missing the one thing you should be looking for. The good news is that there's a way to finally treat the real problem, and I've got it for you. The Untethered Way is the CE course that I wish existed in my early dental years when I was drowning in debt and so unfulfilled in the drill and fill monotony. Inside, you'll learn how to evaluate airway dysfunction in infants, children, and adults. We'll teach you to read CBCTs for airway analysis. We'll help you spot underdeveloped jaws, tethered oral tissues, and structural causes of TMJ dysfunction, and implement real evidence-based treatment strategies from frenectomy protocols to maxillary expansion and myofunctional therapy integration. This course doesn't just give you information, it gives you an entire system, a system to confidently assess, diagnose, and treat patients so that you can stop referring out these complex cases and start becoming the provider everyone else refers to. You'll also get lifetime access to all of our modules, evolving research updates, and 12 months of office hours with real-world dentists who have built thriving airway practices. It's not just continuing education, it's science, and it's the difference between reactive dentistry and transformative care. So if you're ready to stop being a tooth mechanic and start practicing true healthcare, click the link in our bio or comment course under this video and we'll send you the link to join us inside the Untethered Way. This is the present and the future of dentistry, and you deserve to be part of it.
Better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Maggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips,
all to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
My name's Liz Turner, and I want to talk to you a little bit through my journey into airway dentistry. So I'm a kid from a small town in Maine. My dad was in the military. He is a physician. My mom was a nurse. They met when my dad was in residency in St. Louis, and we moved around a lot my first couple of years. I was born in Boston. I'm technically from Massachusetts, but I moved to Maine when I was 6 years old. And I grew up in this small town. Amazing place to live. And you take it for granted when you don't see the natural beauty of the ocean on the daily and you grow up next to it. You think, oh, well, it's just the ocean. But I'm from this small town. Everybody knows everybody. I was painfully shy until I was 12 years old. Painfully. Like, could not keep eye contact, talk to people, could not verbalize, had to have my head down, whispering. I read a book a day. I was out in the woods all the time. Like, we're outdoor kids. There wasn't TV. There was books and the woods. And I look back at my childhood and I think, well, a lot of the things that I'm looking at now in patients that I treat are things that I went through. To the point, like, I would have had the diagnosis of selective mutism because I wouldn't speak unless I really felt comfortable or could. And I, again, product of medical family, it was always assumed I was like the smart one, quote. I was the serious one, quote. My sister was super fun, still is super fun. She's like the spontaneous one. Like, she sees a water body, whether it be like a frozen lake, she'll jump in it. And she's just like the vibrant, fun, up for anything one. And she's in nursing and I'm a doctor because that's just how it was going to be. And so when I said I wanted to go to dental school instead of medical school, my parents straight lost it. Like, especially my mom. No offense, Mom, because you're going to listen to this. But like, you flip and lost your mind. But I had dental trauma. So when I was 8 years old, I tripped, I fell, I knocked out my 2 front teeth. And one of them, they're both, one chipped, the other was re-implanted. And eventually the nerve died. I needed a dental implant. All sorts of things led me to my current dental journey, which is why I talk a little funny. I have what's called a MARPE, assisted palatal expander, and I'm doing a lot of cosmetic stuff because now looking at the ways jaws grow, mine never grew as well as it could for a variety of reasons. So I said I was going to go to dental school, and again, my parents like lost it. But then they were like, well, that's like actually a respectable profession, and you'll still be technically a doctor. Like, I mean, not this kind of doctor, but like you'll be a doctor. So yeah, my journey to dentistry began. But having spent a lot of time in the dental chair and having gone through a lot of things, I thought to myself, well, like, I like this. I like the artistic part of it. I love puzzles. I love detail when it's something that interests me. And teeth are that. Like, building a tooth from nothing requires skill, effort, and artistry, no matter what way you look at it, because that's really the neat thing. If you look at like the dental admissions test versus the medical, there's a really neat component of the dental one where you have to do puzzles. You have to look at spatial awareness, and I was good at that stuff. I'm still good at that stuff. I can't get myself around town, but like without a map, but I have an awareness of like where everything is in our house. Like I live in like a little bit of chaos because I have 2 children and I am too busy to keep my own stuff organized, but I know exactly where everything is. So I call it organized chaos. And I think that's how my brain operates, as you can hear. So I go to dental school. I think I like kids. I don't know anything about them. I'll like work with everybody. I like kids. I like families. I like veneers. I like surgery. And like eventually I did a residency. I went to Tufts Dental School, great school, expensive school, but great school, great education. How lucky am I to have gone through that program? So lucky. Like, there's so many people that want to be there and aren't able to get there, and I was able to. But I looked back at when I graduated and so many of my colleagues went straight into private practice because in medicine, I say this a lot, we're trained that we're the best and that we know what we're doing with our degree. We get a degree and just go use it. And the sad thing is like, we're dangerous when we graduate because we don't know stuff. And I knew that quick. I did a residency in New Mexico and I learned more there than in probably 4 years of dental school. So thanks, Pete Jensen and Gary Cottrell at the University of New Mexico. You guys are rock stars. And I ended up practicing in New Mexico for a while. I'm a distance runner. I'm retired, recovering. And I used to run 100 miles a week because that's how you get fast. You run a lot. And then you don't strength train and you don't really eat, and then your body breaks. But at the time, I was training at a really high level, and it's great to train at altitude. So I trained in Albuquerque. I worked in Albuquerque, and eventually I was like, I gotta get out of here, because if I don't get out of here, I'm gonna stay here. And like, if anybody's been to Albuquerque, no offense to Albuquerque, but like your airport, first place planes are gonna break down. First place you're gonna get delays. There's very few direct flights unless you're going to Phoenix or Las Vegas. And I couldn't see my people. I didn't have anybody there. My family's all over the place. They're in Colorado, they're in Maine, they're in Texas. My friends are all over. But like, I have my community in Albuquerque, but they call it the land of entrapment for a reason, because once you're there, you're not getting out. So anyways, I move to Minnesota. And I move cross country. I moved there on the coldest day in 30 years. It's 60 below zero. And I move to Minnesota, and my best friend and I, she drove me there. We're in tears. It's 60 below zero, but I end up at this amazing place I'd been to a wedding at called the Calhoun Beach Club, right on Lake Calhoun in Minneapolis. And if anybody's been to Minneapolis, like the lakes are essential to everything. And there's such a huge athletic community there that I was there 2 days later. I'm out with a group of probably 15 people, the Calhoun Beach Running Club, running in 14 below zero and just like kicking ass. These guys, nobody messes around with winter. Like, we embrace winter in Minnesota. And I mean, it was so easy to fall into that community athletically and eventually find my place in dental. So I look back at my training for athletics and I think, how better could I have been if I had had better alignment, better breathing, better oxygen capacity? And the answer is better. How much? I don't know. I don't have that answer. I never will. So I was in public health at the time, and I was just kind of fixing teeth. And I did public health because I felt a responsibility to the patients that I'd seen in New Mexico who had come to the university because there was nowhere else to go. And there's a huge health disparity in our country. And there are people without the resources to get out of pain and to get themselves fixed. And so I went into public health to give back to the patients that I felt I had learned so much from. And so that's how I looked for jobs everywhere. I eventually settled in this amazing community health center in Minnesota. And I had such an incredible cultural experience. There's a big Hmong population in Minneapolis, and we would have Fear Factor potlucks where we just eat whatever anybody would bring. So like chicken feet and bugs and stuff. And it was an amazing experience, but I knew that clinically I wanted to evolve. So I eventually was in an amazing private practice where we focused really heavily on fear-based dentistry because there's a lot of people that feel really uncomfortable in the dental office. And if you're listening, you may be one of them. But dentistry is hard. You can't see what we're doing. You don't know what's happening next. You're scared there's going to be discomfort. And having been a patient who's had a lot of long appointments and a lot of things done, I can empathize. And I like to think that I'm a nice and empathetic person, and I like to try to relate to people. And so it was a great environment for me. And we did a ton: surgery and root canals and crowns and fixing stuff that was broken. There wasn't a ton of prevention, nor was there a ton of emphasis on it. It's not the way the practice was designed. But fast forward, I meet this wonderful guy. His name's Mike. He's from Wisconsin. He's pretty funny. We get married. We have a baby. And I was like, this baby seems kind of cranky. And I just didn't really get it. But the baby seems cranky. And so that's where stuff shifted. I'd been a general dentist for 8 years. I have this baby, and I think there's something different about this baby. I don't know anything about babies, but sample size of 1, he sure seems mad. And he was just uncomfortable. And I had a colleague in dental school who is a pediatric dentist in New Hampshire. Her name is Danielle Hinton. And I'd seen her posting some stuff about tongue ties and a laser. And so I was like, Danielle, what do you think about this tongue tie thing? Because in the hospital, they were like, he's latching fine, but he's got this mild tongue tie. And we all joke that it's like being mildly pregnant. That's like something we hear a lot. So you're not mildly pregnant. You're either symptomatic and tied or you're not. And so I have this baby, and she sees a picture and she goes, I can't diagnose from a picture, but that tongue is very likely restricted. You should go get it checked out. So I go, this is years ago, right? So it was 7.5 years ago now. I go and I get the baby treated because body work, functional work, wasn't a huge emphasis on it. And we just fix it. So we fix it and things are better-ish. I mean, as much as I knew about babies, but overall, demeanor pretty quickly changed to more comfortable because there was a lot of air intake. And we were like those parents at 8:30 at night. I remember my husband aggressively rocking this child singing gangster rap lullabies. So it was 1990s and Mary Had a Little Lamb Had a Baby. And that's what he would sing. And it got to a point where we were just we don't know what to do. And I'm not a big fan of letting them cry. And we didn't. We tried to console them, but it couldn't really help him. And, we treat him 5 weeks in, so it's not been going on that long. And 3 days after I had my boy treated, my father-in-law had a heart attack due to years of undiagnosed sleep apnea. He'd been on a CPAP for a bit, but either way, because of sleep apnea, in part, he had developed atrial fibrillation and eventually threw a clot. I'd been saying he was going to throw a clot for a while. My mom is in the cardiac space. So we have a lot of very close friends who are cardiac-minded cardiac surgeons, perfusionists, all sorts of different. She started a cardiac surgery center. So cardiac stuff had always been interesting to me. And I know blood values well enough to know that his were way off. So anyways, I'd been saying, guy's going to throw a clot, improperly anticoagulated. But like my in-laws, who I adore, are not medical questioners the way that I have been raised to be. Because in my household, it was always like, well, that doctor's wrong. Go get another opinion. That doctor's wrong. Go get another opinion. Because like, that's what people in medicine do. We're always like, well, we're smarter than them, and so go get a different opinion, and that person's wrong. So that's not my in-laws. And so nobody ever questioned it. And they would say, it's fine. We'll change the medicine. We'll do this. We'll do that. Well, like throws a clot and he has a heart attack in the door of the emergency room. And he was actively in cardiac arrest. His dog, this stupid pug, like pugs are dumb. I have one. He's dumb as bricks. But like this dog sat on this man's chest for 15 minutes while he was having chest pain and just sat there and looked at him. And he was like, fine, Rocky, I'll go to the emergency room. So he told his wife, Jean, I'm having a problem. I need to go to the hospital. And so she drove faster than she normally does. And the doctor, he arrested when he walked into the door of the emergency room. And he's a very practical person. He's an engineer. He remembers seeing his body floating above himself while they were doing CPR. So he has this heart attack. And I mean, it's traumatic. My son's 5 weeks old. We throw the kid in a car. We drive to Kansas City through the night. I threw my husband on a plane. He flew there. Wayne survives. So Wayne survives the cardiac arrest. But then what happens? Well, again, I'm just a dentist, but they had done really good CPR and they saved his life. But when they did that, they cracked his chest and they lacerated some vessels. And now a man who was improperly anticoagulated is very well anticoagulated. And he has a hemothorax and his pressures were dropping. And again, I've got all these cardiac surgeons on the line and they're like, something's wrong. And I was like, guys, something's wrong. And they're like, no, the doctor says it's fine. I'm like, something's wrong. And they're like, no, the doctor says it's fine. He's just recovering from the heart attack. So anyways, he's in a medically induced coma for 7 days after this hemothorax, which nobody noticed, even though his pressures were down to like basically zero. And my biggest question is, if I have a child who's symptomatic and we treat them and we help change their growth trajectory, could we potentially change the growth trajectory so favorably that they don't end up with significant cardiac events, medically induced comas, and ultimately years off their life because of damage? Because when you look in Wayne's mouth, what you see is a bilateral posterior crossbite, an incredibly narrow arch form maxilla, an incredibly restrictive tongue. For those of you that are listening to this who know numbers regarding range of motion ratios, he's a grade 3, not compensating at all. So he's had a speech impediment since he was 4, which had always concerned him. And my thought process is growth is a continuum that starts very early. And had we looked closer at the speech impediment, maybe released a restriction, maybe looked at orthodontics as more than cosmetic, could we potentially have improved the breathing capacity so much that we could have reduced the risk of further systemic disease? Because if we look at the literature on sleep apnea or sleep disordered breathing-related sleep disorders, and what it causes systemically, it's significant in every space in medicine. The book Why We Sleep by Matthew Walker is one of my favorites because it really breaks down the impact of oxygenation in sleep in almost every facet of health. Well, jaw growth influences breathing, which influences disordered breathing. So if we have jaws that are ideally formed, if we have broad arch form, if we have a mandible and a maxilla that fit together in harmony, if we have functional patterns in our system, we bring more stability to the whole system. We have less airway collapsibility when we nasal breathe versus mouth breathe. We have less disrupted quality of sleep when we nasal breathe versus mouth breathe. We have less systemic inflammation when we nasal breathe versus mouth breathe. But if we can't nasal breathe because our maxilla and our nasal cavity are so compromised, how can we expect to breathe well? Because we're all breathing, like that's our body's job, and that's our desire and our drive. But we do it with compensations. We kick ourselves out of the quality that our body needs. And what parent, what person doesn't want better health? We all look at things that influence our health, right? We take vitamins, we eat healthy, we wear blue light glasses, we try to go to bed on time, we look at certain aspects of health as more important than others. And we put an emphasis on sleep, but we don't look at the layers that go into it. And sometimes we miss the structure. Because what else? Well, muscles influence jaw growth. And the problem is that most jaw growth is complete by the age of 6. 85% of the craniofacial respiratory complex, the midface, the maxilla that supports the top dentition, the orbits, the nasal cavity and floor, that's the midface. That also supports the mandible, the lower jaw. Muscles and tension in appropriate places with adequate function, appropriate function, influence jaw growth. And we can't argue against that because pressure in the right places changes a growth pattern. Same thing, pressure in the wrong places. Have you ever seen a baby in a helmet? A baby in a helmet is a flat spot because there's been too much compression in that space. So we really need to look more closely at early childhood influencing jaw growth, which further influences breathing patterns. Because this is something that we run into a lot. Where's the research? Well, the problem is there are so many factors that go into it. And every little detail, including where you live, what are your genetics, all of this stuff is going to have some influence on growth as well. So to say that releasing a tongue tie to improve function prevents apnea 100% of the time is false. We can't say that because there's genetic factors, there's environmental factors. There's so many other factors that go into just apnea. What about it being a part of the growth continuum? So for me, what I always try to look at is what are the layers to this onion in health? Because I do that with myself and with my kids and with my husband and with anybody I can get to listen to me half the time. Because, and sometimes it's overwhelming because, and I think a lot of us in this space feel it, that you're fighting an uphill battle at times. And ultimately, all we're trying to do is help someone live with a better quality of life. Like, I will never say a tongue tie will prevent all orthodontics. A tongue tie will mean your children will have no speech issues. A tongue tie will prevent sleep apnea. Because that's not true. But it is one huge part of the puzzle because that restricted tongue mobility, it is an independent risk factor for a narrow maxilla. A narrow maxilla has so many impacts on occlusal trauma, tooth wear, jaw issues, ADHD. Not that the narrow maxilla causes ADHD, but if we look at the signs and symptoms of ADHD, they're the same as sleep-related breathing disorders. So maybe we're not looking at the structure before we give someone a diagnosis. There are so many factors that go into health, and I think my goal as a clinician is to continue to look deeper at how I can help families and to provide the services I can as a structuralist. So I'm a structuralist. I'm the one who's assessing the structures of the oral cavity. And that could be the teeth, it could be the soft tissue, it could be the bone. And ultimately, when we make changes, we're looking to improve something. Maybe we're doing some veneers for somebody. That is improving the cosmetics and giving them the outcome they desire. Maybe we're doing palatal expansion on somebody. That is improving the foundation to improve all of the things that go into foundational stability. So that's aesthetics, that's breathing, that's function. And maybe we're releasing something like a tongue tie to give somebody a better opportunity for early childhood feeding. We treat a lot of these in infants, and that's why I'm kind of focusing on that. We treat a lot in older kids and adults too. And I don't have the literature to back this up, but structurally the tongue is attached through our whole body. And when we release these ties, it is near 100% of the time that when we get to a certain level, people will experience some form of tension release. Maybe the eustachian tube pops. Maybe it's in the anterior pharynx. Maybe it's in the back of the occiput. Maybe it's in their shoulders or their diaphragm. But there is a structural tension release when we release the area that is holding that tension. And so I think the hard part is you can't put a blanket statement on everything and say one thing's going to fix it all. And everybody's going to be impacted differently by stuff. But just because somebody's positively influenced doesn't mean that they're wrong. Like, why not let somebody experience the relief that they've been desiring and seeking when they go to the chiropractor every week? Maybe it is a quality of life issue when they can't mobilize their tongue and swallow a pill. We actually see a lot of patients that are more interested in like being able to kiss their partner. It's kind of wild, but like the tongue's important for lots of stuff. So again, my journey, I never thought as a dentist that this is where I would be. I am lucky. I have 2 practices. One's called Balance Dental Studio. It's a functional dental practice where we really focus a lot on airway health and root cause dentistry. What caused the cavity? How can we fix it? How can we prevent it? And then my other practice is called Untethered Airway Health Center. And that's why you're listening to this podcast, because as my practice has grown, I started Bloom Center for Sleep and Airway outside of my dental practice. So we're all in this one facility. I'm in this teeny tiny room right now. We're moving out of this facility that I've been in for 5.5 years now into a new one in September. The dental practice has already moved. Untethered is moving into a more favorable environment for families so we can better support people in an environment with natural light and better aesthetic and more comfortable. But I look at where we've grown and I see the change in people over the years as we've treated them. And it's really fun to witness and be a part of the puzzle. Again, I'm never going to say like I'm going to fix it all because I can't do it alone. But that's why I have so many other amazing colleagues that we work with in interdisciplinary care. And I have so many families that continue to share their journey with others. We're lucky. We have a lot of really positive reviews that drive people here, because I think when you change somebody's life, they're willing to talk about it. So I am really grateful for all the families who've trusted us with their care. I am just looking forward to the growth we can all keep having together. So thank you so much for listening, and follow us on this journey that we call airway health. I think COVID really pushed a lot of us to start asking better questions of our health. And I mean, if there's anything that a global pandemic caused something positive to come from, it's more focus on prevention versus reaction. So let's all continue to prevent bigger stuff together by looking at the little details that go into health and growth, and work to have a healthier society overall. So again, I'm Liz Turner, and I'm one of the co-hosts of this podcast, and I hope that we can continue to bring really insightful and relevant information to you all.
Thank you for joining us on the No One Told Me, the Airway Health Connection, the Untethered Way.
We hope you're leaving with new insights and feeling empowered to take charge of your airway health.
If you enjoyed this episode, be sure to subscribe and share it with anyone and everyone who needs to hear it.
To learn more or get in touch, visit us online at untetheredairwayhealthcenter.com.
Remember that when you breathe better, you live better.